how do I know if I have an infection after having nail surgery? So when you have nail surgery, and in this case I particularly mean nail surgery where you've had the phenol, the chemical, applied to the nail bed. The thing with these chemical nail surgeries is that it causes a chemical burn, which means that it's a wet wound and that lasts for a few weeks. So it's going to look wet, it's going to look gooey, it's going to look a bit infected. That's completely normal and nothing to worry about. So don't panic. That's the first thing. As for if you have an infection, what you normally want to do is you want to be keeping an eye on the toe every day, and you should be doing that anyway because you're bathing the toe every day in salt water. But you're going to keep an eye on the toe every day, bathe in salt water, and then if it starts to change, so if it goes from being a sort of darker, duskier red, if you're someone with pale skin like me, and then it goes to a bright, bright pink, then you might have an infection. If the skin goes from having been quite loose and wrinkly, which is often the case, to them being quite tight and even shiny, then again you might have an infection. The other things to look out for are increased pain, especially if it's after you've been resting as opposed to when you've been doing more work. So if you've been painting the house, doing lots of DIY all day and it starts to hurt and you're only a couple of weeks after you've had the procedure, you can kind of expect a bit of pain, and you deserve it, but in a good way. I'd rather you keeping active and then find out you've done a bit too much. So you'll have pain, there'll be some redness, there'll be some swelling, and the other thing is loss of function. So you may find that your toe is much harder to wiggle. It's nothing to be worried about if it's in the very early days after the procedure. It's quite normal, in fact, to have these symptoms because they're also signs of inflammation. But if those continue for longer than the first few days, or they get worse, so it starts to improve and then it gets worse, then at that point I would then start to consider that there may be an infection. In particular if you're a sweaty, smelly boy. We're worse for that sort of thing.